Coronary artery disease is one of the leading causes of health problems worldwide. But did you know that many of its risk factors can actually be managed or reduced? In this video, we'll explore practical ways to lower your risk for coronary artery disease, starting with understanding what puts you at risk in the first place. By learning about these factors, you can take the first step toward a healthier heart and a longer, more active life. Let's begin by breaking down what coronary artery disease is and why it's so important to address its risk factors early. Coronary artery disease, often called CAD, happens when the blood vessels supplying your heart become narrowed or blocked. This can lead to chest pain, heart attacks, and other serious complications. The main cause is a buildup of fatty deposits known as plaque inside the arteries. Over time, this buildup restricts blood flow and puts extra strain on your heart. Understanding this process helps us see why managing risk factors is so crucial for preventing heart problems down the road. There are several major risk factors for coronary artery disease. Some, like age and family history, can't be changed, but many others are within your control. These include high blood pressure, high cholesterol, smoking, diabetes, obesity, physical inactivity, and an unhealthy diet. By focusing on the factors you can change, you can make a big difference in your heart health. Let's take a closer look at each of these modifiable risks and how you can address them. Smoking is one of the most significant risk factors for coronary artery disease. The chemicals in tobacco damage your blood vessels and accelerate plaque buildup. Quitting smoking can quickly improve your heart health no matter how long you've smoked. If you need help quitting, talk to your doctor about support programs, medications, or counseling. Remember, it's never too late to stop smoking and start healing your heart. High blood pressure or hypertension puts extra strain on your heart and arteries. Over time, this can lead to serious damage and increase your risk of coronary artery disease. You can help control your blood pressure by eating a balanced diet, reducing salt intake, exercising regularly, managing stress, and taking prescribed medications if needed. Regular monitoring is also important to catch any changes early. High cholesterol is another major contributor to coronary artery disease. Too much bad cholesterol, or LDL, leads to plaque buildup in your arteries. You can manage cholesterol by eating more fruits, vegetables, and whole grains while cutting back on saturated fats and trans fats. Sometimes medication may be necessary, so be sure to follow your doctor's advice and get regular cholesterol checks. Carrying extra weight, especially around your waist, increases your risk for coronary artery disease. Maintaining a healthy weight reduces strain on your heart and helps control other risk factors like blood pressure and cholesterol. Focus on gradual, sustainable changes in your eating and exercise habits. Even a modest weight loss can have significant benefits for your heart health. Physical activity is one of the best ways to lower your risk of coronary artery disease. Aim for at least 150 minutes of moderate exercise each week, such as brisk walking, cycling, or swimming. Exercise helps control weight, lower blood pressure, and improve cholesterol levels. Find activities you enjoy and make them a regular part of your routine for lasting heart health benefits. Heart-healthy diet is rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit processed foods, sugary snacks, and foods high in salt or unhealthy fats. Try to cook more meals at home and experiment with new recipes that focus on fresh, wholesome ingredients. Small changes in your daily eating habits can add up to big improvements in your heart health over time. Drinking too much alcohol can raise your blood pressure and add extra calories, making it harder to maintain a healthy weight. If you choose to drink, do so in moderation. Generally, that means up to 1 drink per day for women and up to 2 for men. Remember, less is often better when it comes to alcohol and your heart. If you have diabetes, keeping your blood sugar under control is essential for lowering your risk of coronary artery disease. Follow your treatment plan, monitor your blood sugar regularly, and work with your healthcare team to make adjustments as needed. Healthy eating, regular exercise, and taking medications as prescribed all play a role in managing diabetes and protecting your heart. Chronic stress can take a toll on your heart by raising blood pressure and encouraging unhealthy habits like overeating or smoking. Find healthy ways to manage stress, such as deep breathing, meditation, yoga, or spending time with loved ones. Taking time to relax and recharge is an important part of maintaining your overall heart health. Sleep is often overlooked, but it's vital for heart health. Poor sleep can increase your risk of high blood pressure, obesity, and diabetes, all of which contribute to coronary artery disease. Aim for 7 to 9 hours of quality sleep each night. Create a relaxing bedtime routine and keep your sleep environment comfortable and quiet for the best results. While you can't change your genetics, knowing your family history of heart disease can help you and your doctor make informed decisions about your health. If close relatives have had coronary artery disease, you may be at higher risk. Share this information with your healthcare provider so you can work together on a personalized prevention plan. Routine checkups with your healthcare provider are essential for catching risk factors early and monitoring your progress. These visits allow you to track your blood pressure, cholesterol, blood sugar, and weight. Early detection and management can prevent small problems from becoming serious health issues. If your doctor prescribes medication to manage blood pressure, cholesterol, or other risk factors, it's important to take them exactly as directed. Skipping doses or stopping medication without consulting your doctor can increase your risk of heart problems. Always talk to your healthcare provider if you have concerns or experience side effects. Drinking enough water is important for overall health, including your heart. Proper hydration helps your body function efficiently and can support healthy blood pressure. Aim to drink water throughout the day, especially if you're active or in hot weather. Avoid sugary drinks, which can add unnecessary calories and affect your heart health. Too much salt in your diet can raise your blood pressure and increase your risk of coronary artery disease. Read food labels, cook more meals at home, and use herbs and spices instead of salt to flavor your food. Small changes can make a big difference in your heart health over time. Eating more fiber-rich foods like fruits, vegetables, whole grains, and legumes can help lower cholesterol and support heart health. Fiber also helps you feel full, making it easier to maintain a healthy weight. Try adding an extra serving of vegetables to your meals or choosing whole grain options whenever possible. Not all fats are created equal. Replace saturated and trans fats with healthier options like olive oil, nuts, seeds, and fatty fish. These choices can help lower bad cholesterol and reduce your risk of coronary artery disease. Remember, even healthy fats should be eaten in moderation as part of a balanced diet. Staying active every day, even with small movements, can make a big difference for your heart. Take the stairs, go for a walk during breaks, or stretch while watching TV. The key is to keep moving and avoid long periods of sitting. Every bit of activity adds up to better heart health. Tracking your progress can help you stay motivated and see the benefits of your efforts. Keep a journal of your blood pressure, cholesterol, weight, and exercise habits. Celebrate your successes and use setbacks as learning opportunities. Regular monitoring keeps you focused on your heart health goals. Having friends, family, or a support group can make it easier to stick with healthy habits. Share your goals with others and encourage each other along the way. Support systems provide motivation, accountability, and a sense of community, all of which are important for long-term heart health. Processed foods often contain high levels of salt, sugar, and unhealthy fats. Limiting these foods can help you control your weight, blood pressure, and cholesterol. Choose fresh, whole foods whenever possible and read labels to make healthier choices. Cooking at home gives you control over ingredients and portion sizes. It's easier to prepare heart-healthy meals and avoid hidden salt, sugar, and unhealthy fats. Try planning your meals ahead of time and involve your family in the cooking process for added fun and support. Eating large portions can lead to weight gain and make it harder to manage other risk factors. Use smaller plates, measure servings, and pay attention to hunger cues. Eating slowly and mindfully helps you enjoy your food and recognize when you're full, supporting a healthy weight and heart. Whole grains like brown rice, oats, and whole wheat bread are rich in fiber and nutrients that support heart health. Swap out refined grains for whole grain options to help lower cholesterol and keep you feeling full longer. Making this simple switch can have a lasting impact on your heart. Fruits and vegetables are packed with vitamins, minerals, and antioxidants that protect your heart. Aim to fill half your plate with colorful produce at each meal. The variety not only supports your heart but also makes meals more interesting and enjoyable. Consuming too much added sugar can lead to weight gain, high blood pressure, and increased risk of diabetes, all of which are risk factors for coronary artery disease. Check food labels for added sugars and choose natural sources of sweetness like fruit instead. Lean proteins such as fish, poultry, beans, and legumes are excellent choices for heart health. They provide essential nutrients without the saturated fat found in red meat. Try to include a variety of lean proteins in your meals to keep your diet balanced and your heart strong. Consistency is key when it comes to lowering your risk for coronary artery disease. Small, daily habits add up over time. Don't get discouraged by setbacks. Focus on making healthy choices most of the time and remember that every step counts toward a healthier heart. Learning about coronary artery disease and its risk factors empowers you to make better choices. Stay informed by reading reliable sources, attending health workshops, or talking with your healthcare provider. The more you know, the better equipped you'll be to protect your heart. Setting achievable goals helps you stay motivated and track your progress. Start with small changes like adding an extra serving of vegetables or walking for 10 minutes a day. As you reach your goals, set new ones to keep moving forward. Celebrate your achievements along the way. Even if you don't smoke, exposure to secondhand smoke can increase your risk of coronary artery disease. Avoid places where people are smoking and encourage loved ones to quit. Clean air is essential for a healthy heart and overall well-being. A positive outlook can help you manage stress and stay motivated to make healthy choices. Surround yourself with supportive people, focus on what you can control, and practice gratitude. A healthy mind supports a healthy heart. Too much time in front of screens can lead to a sedentary lifestyle, which increases your risk for coronary artery disease. Take regular breaks to stand up, stretch, or move around. Try to balance screen time with physical activity for better heart health. Mindfulness practices like meditation and deep breathing can help reduce stress and improve your overall well-being. Taking a few minutes each day to focus on the present moment can lower blood pressure and support a healthy heart. Social connections are important for emotional and physical health. Spend time with friends and family, join community groups, or volunteer. Staying connected can help reduce stress and encourage healthy habits, both of which protect your heart. Pay attention to how your body feels and respond to warning signs like chest pain, shortness of breath, or unusual fatigue. Don't ignore symptoms, seek medical advice promptly. Early action can prevent serious heart problems. Knowing what to do in a heart emergency can save lives. Learn the signs of a heart attack and have a plan for getting medical help quickly. Share this plan with your family so everyone knows what to do if the unexpected happens. Medical research is always advancing, and new information about heart health becomes available regularly. Stay updated by following reputable sources and discussing new findings with your healthcare provider. Being informed helps you make the best choices for your heart. Promoting heart-healthy habits in your family and community can make a big difference. Share what you've learned and support others in making positive changes. Together, you can create a healthier environment for everyone. Taking steps to lower your risk for coronary artery disease is something to be proud of. Celebrate your achievements no matter how small. Recognizing your progress keeps you motivated and reminds you that your efforts are making a real difference for your heart. Let's quickly review the key ways to lower your risk for coronary artery disease. Quit smoking, manage blood pressure and cholesterol, eat a healthy diet, stay active, maintain a healthy weight, manage stress, and get regular checkups. Remember, every positive change you make supports a healthier heart and a better quality of life. Lowering your risk for coronary artery disease is a lifelong journey. By making small, consistent changes and staying committed to your health, you can protect your heart for years to come. Remember, your heart health is in your hands. Take action today for a healthier tomorrow.